Hello, I'm Dr. Maria Sulindro, integrative anti-aging and complementary medicine practicing in Pasadena, California. The topic today is genetic testing, and it is a one medical testing that I offer. And when the result is complicated, I will always ask the genetic specialist or research specialist to assist me. Today, you will hear about genetic testing, and I learned to help learn to help yourself to understand about genetic testing. I will cover the first one is what is the definition of genetic testing as a medical testing, which is a health informations. And second, why is genetic testing needed? Number three, how is genetic testing done? And the last one will be, what is the benefit of having a genetic testing? So the first one, definition. Genetic testing is a medical testing, also known as a DNA. DNA stands for deoxyribonucleic acid. And this testing is to identify chromosomes, structure, or protein information in all living things. For example, human, plant, microorganism. So those you can do the genetic testings. This one also includes measuring result of genetic changes as what we call genetic expression of RNA. RNA means ribonucleic acid. Genetic testing is generally for confirmation of suspected genetic condition or people's chances of developing or passing their genetic disorder to their children, right? And then it can also analyze the cells or the tissue to look for changes. These changes can be in chromosomes, which is the thread-like structure in your cell contains DNA and protein. Gene is part of DNA that carry information needed to make the protein. And protein is very important and do the most of the work in your cells. If changes is found in the genetic testing, this might be changes in your DNA. So do we need genetic testing, or why we need a genetic testing? Many reasons towards yes, we need the genetic testing. I will point out about maybe 4 common reasons. The first, genetic disease in unborn baby. So this is called prenatal testing, done between weeks 14 through the 20th of the pregnancy. This is to detect abnormal chromosomes such as found in Down syndrome baby or trisomy 18 baby, spine and brain problems. This can also show the sex of the baby so that the parents can prepare their room or, gift registry. It is covered by health insurance for standard testing should you choose to have it after age 35. I guess the risk of the disease is higher, so health insurance will cover this test. Second, why we need this testing is to screen born babies for treatable conditions. For example, a very famous one is the story of Page baby. I think they found the problem at the Mayo Clinic. This is an genetic enzymes deficiency. Paige was 7 years old when she has a lot of pain in the joint, and it's progressively become worse. The stiff joints will not allow her to attend like physical activities in school. Many of the teachers and the students think that she's just trying to avoid the activities because she had gone to several common physicians or non-specialty physician, and they checked everything and they couldn't find anything. So the parents did not give up though. They explore and they pursue. And when they saw one of these Dr. Viro at Mayo Clinic, he found out that she has lysosomal storage disease. So it is a problem with multiple genes, and it is small changes that is very meticulous, and it's progressive. Paige has what we call enzyme deficiency. So when after they give this an intravenous enzyme weekly, she gets better and she perform all activities like a normal student, and this can be treated for the rest of her life. So then the other important thing about doing this test is to lower the risk of genetic disease in embryo that are created using an ART, which is assisted reproductive technology. The test is called ECS, Expanded Carrier Screening. This is very helpful because, for example, this will be um, analyzing the deadly disease in children with cystic fibrosis disease. This is a deadly lung disease, or SPA, spinal muscular atrophy. This is a lethal disease at a very young age. This is caused by silent recessive mutations. The last one is to help you find if you have carrier gene disease that can be passed to your children, right? So carrier is a person who has a disease trait but does not have any physical symptoms or disease itself. They can pass on this carrier mutation gene to their children. Example of this genetic carrier disease is Down syndrome. This is the trisomy 21, characteristic featured with delayed physical and cognitive function. Sickle cell anemia, you heard about that. It's a hemoglobin S. Usually it's hemoglobin A for us. This one, hemoglobin S. The abnormal shape, and it stick together, and the patient has a lot of pain. Next one is hemophiliac, also commonly called the bleeder. They have problem with clotting. And another example is Marfan syndrome. And the very famous story about Marfan syndrome in United States is our 16th president, President Abraham Lincoln. But I think I review it again. He has this Marfanoic features where they seems to have a very tall and slender posture and physical, and their fingers are abnormally long, very long. And so, but unfortunately, President Abraham Lincoln was murdered, and they still think they wanted to do the genetic testing, but because this genetic mutation in Marfan's disease is very complicated, they decided not to do it. And but they do believe that Marfanoic features can also be one of those carrier that is not necessarily carrier. They said it can be like a genetic mutations, but not very problematic, or because Abraham Lincoln did not have eye problems, and he did not have any heart murmur, so all he had was just physically looks like Marfan's persons. Let me see if I have questions. The question is, how much is this genetic testing? I think I will mention it later. Okay, you can hear that. And can genetic testing be done when a person already died? Yes, because you can even go back and find any of their tissue, and then you can still do the testing. And just like the President Lincoln, they decided not to do it, not because he's dead, but they were going to see if he had a Marfan's genetic mutations, but they didn't do that. So the third one is, how is this genetic testing done? I think you'll be curious. Well, standard testing is done used in any genetic lab, um, even the Cell Research Institute, or 23andMe lab, very famous, or Ancestry lab, or Genetic Digest lab, right? Some are connected to a very big hospital like Massachusetts General Lab is called, and Massachusetts General is called NAG Lab. It's a New Amsterdam Genetic Lab and Mayo Clinic Lab. So these are all big names that have sold the genetic test kits in millions. They're using usually blood samples or cheek swab, the saliva in the cheek, basically. It's very commonly used. And then hair, they cut the hair, or now even I use a hair follicle for epigenetic. And then you can collect saliva and then ship it or send it in, even in weeks or months, it's still working. They also can do it through the skin and amniotic fluid for the babies and other tissues. There are many methods and techniques in this lab. The most common one is called molecular genetic testing, which is a single gene, and variation of that lead to the genetic disorder. The second one is called chromosomal genetic testing, and they analyze the whole chromosome of length of the DNA to see if there are large changes such as extra copies that cause genetic mutations or genetic conditions. The third one is biochemical genetic test study, activity of the protein itself. So they look at the abnormal changes of the DNA that result in the genetic disorder. Example of popular genetic testing for health informations. I'm sure you heard about this Angelina Jolie's genetic testing, very famous, right? It's a BRCA1 and BRCA2. BRCA spelled as BRCA. The first two letters is a breast cancer, and then CA is cancer. Yeah. So this blood testing is for higher risk of breast cancer. So in the Angelina Jolie's case, she was found positive, and she did what we call preventive bilateral mastectomy, and then she did breast implantations. But nowadays I found out that it's not necessary. When you have BRCA positive in genetic testing, you can consult with the specialist of the genetic, and they will they will give you advice and protocol of how to avoid that. And I heard the number of suppression of this expression of the abnormal genetic is 98%, which is very high. So Mayo Clinic genetic cardiologist does a popular test for cardiac gene testing. So you can um, find out first if you are going to have what kind of cardiac problems in the future. So the lifestyle changes can also prevent that. And then also the genetic testing to delay of development of the children. Genetic testing has become very popular recently. Less than 1 million tests was ordered in 2013, and last year alone, 2019, there were like 30 million tests were done, and they uh, even projected that in 2020 will be 50 million genetic testing being ordered. It looks like more and more uh, readiness for these populations to accept the genetic testing, because they are encouraged to learn that uh, the epigenetic, which is other than the gene, can influence the genetic expression or carrier, the genetic expression. So for example, if you have this positive abnormality or mutation of gene for diabetes, and they will coach you so that hopefully in your life you will not have diabetes, which is possible now. In our office, we offer several kind of gene testing, from less expensive one, or we call it personalized, that costs less than $1,000, to the most comprehensive one, which covers 22,000 genes, done by Massachusetts related NAG lab, New Amsterdam Genetic Lab, and this costs you $3,500, include the interpretation and support by their research scientists, and it's I think connected to the portal that you own it for life, and then you can chat with them, and they each of the mutation or carrier, there is like a link where you can click and you can find out about the lifestyle protocol or lifestyle advice, which is very interesting. And in general, genetic testing results often can provide the opportunity for the patients to decide what they want to do with their future health. No matter at which stage of their life you do it, they do it, it's going to be very helpful for that decision alone. The last one is, what are the benefits of having this gene testing? It sounded that you already know, okay, is for prevention, but let me just specify one by one. By giving the doctors the result of your of patient's genetic testing, the doctor can then recommend more personalized treatment plan for the patients. That is a win-win situations for both, right? And the second one is giving more information to make decisions about your health and a family's health. Because sometimes you have many children, right? And so it's good for them to know what is upcoming in their health lines. Or we can review which lifestyle goes against this DNA abnormality or mutation, and we can try to prevent the abnormal gene expression. Isn't that cool? I think that's the best. Okay. Also, we can also skip unnecessary checkup. You know how in my office at least, I test even twice a year or 3 times a year some of the normal value of a certain test again and again just in case. But if you have a gene testing, and then many of these can be avoided. And then also this gene testing can give you some information so you can make decision about having children or not having children, right? Yeah. So also identify the genetic disease early in life so treatment can be started as soon as possible. Question is, how long is the result come out? About 2 weeks. Yeah. Sometimes if you go subscribe 23andMe maybe in a day, but or a week, but usually it's 2 weeks. And are they covered by the healthcare insurance? Some are, because many of these are FDA approved, and especially if, because you have to you fill in all the forms and questionnaires, and they decide whether this is covered or not. It's a pre-authorized prescription request from the doctor. Every person is unique, and that can be seen by their DNA in the genetic testing. For example, let's use a cancer. If you have been, if you have a diagnosis of cancer, the cancer itself is unique, and so does the treatment. This can be treated better if we know the person's DNA. There is a specific cancer uh, diagnostic, which is gene diagnostic, with for example, comprehensive genomic profiling. It's called CGP. CGP is testing of 300 some genes for cancer relevant, that that shows a mutation in the DNA of the tumor. It is for a solid tumor only, and they will give us the biomarkers in this testing. It is approved by the FDA and is covered by Medicare for qualifying patients. It is looking at finding the mutation in our cancer DNA that may be causing the cancer to grow. And it is a guide for targeted therapy. The oncologist will decide whether the patient needs immunotherapy or clinical trial that is right for you. You know, they can decide after looking at the results. This is done by a blood draw and analyzing about the 300 genes. Now the famous name of this one is liquid biopsy, non-invasive. So you just draw blood and send the blood. From the United States statistic, 1 out of 3 people will be diagnosed with cancer in their lifetime. That's pretty high, it's 30%. The ancestry genetic tests that we're talking about, you know, looking into our ancestry is not this one. So there are several type of genetic testing in a big group, and one is like family history. The second one is ancestry. You know, like maybe like if you want to find out how many percentage in you is Indian or Asian Chinese, you know, ethnic, right? And then there is another one called personal gene, okay, personalized gene testing. And the fourth one is health info, is the one that I'm talking about. And sometimes they also do a group genetic study for community. In review, we have covered genetic testing, how it has make the patients decide for their health in the future. So now you know what genetic testing is and why is genetic testing done, and how the genetic testing is done and what the benefits are. So, progress in the medical research today has given patients more information for their medical decision to keep in an optimal health. This month, we are discussing about the field of genetic and epigenetic. And let me see. I cannot see there, but let me see here. Is there any benefit for the elderly to have this test? Definitely. There's no limit in lifetime. Like before you were born, there is always benefit because this is a reading of one's interpretation of the gene for life. So any time in your life, you will benefit from it. How is gene testing and telomeres testing related? Gene testing is a study of the DNA, okay? And there is like a protein in there, you know? And telomeres is the study of the tip of the chromosome. The telomere study is also available right now. And telomeres is the tip of the chromosome. And we believe, or the science find out that you were born with a certain number of telomeres at the end of your chromosomes. And nowadays, they even find out that you can lengthen that telomeres because when these telomeres is done breaking up, and you basically your life is gone. So they can test, for example, if you're 70 years young and your telomeres testing shows that you're 74, then they will give you supplements. Actually, it's still in a supplements form, which is TA65. That's the only one that is in the market right now to lengthen it. I have tried in 2 patients, and basically it was successful after 1 year, and it does lengthen the telomere. So this patient was 72, and the telomeres testing showed as 74. And when after a year of taking that supplements, telomere testing became 71. No, 73. So 1 year benefit. Not too bad, right? So, okay. Thank you for asking a very good questions. Oh my gosh. Okay, so is MTHFR a gene testing? Yes. MTHFR is a methylation gene testing. It's called methyl tetrahydroxy folic reductase. So it's an enzyme of the methylation process. And in this case, to find out that if you have a mutation in that gene, then you have a little problem with methylating like processing from the raw material of what you eat to the end product of what you need. MTHFR is very common and famous for folic acid, which is if it's methylated and became methylated folate, and the B12, methylated B12. 40% of the population seems to be affected and has this kind of mutation of MTHFR. It's a very common testing now. I suggest for everyone because if your MTHFR is affected, then or mutated, then you have a tendency as you grow older, you become a little bit more anxious, okay, and stressed, more stressed, sensitive, or sometimes depressed, easier to get depressed, have problem with sleeping, and some people become very depressed also and lost memory. So it's very useful, MTHFR testing. Thank you. Very good questions. Now that you have asked a very good question, I would like you to tune up every Thursday. And if you like this information, please subscribe and like us and share with your friends. This is Dr. Maria Solindro, Integrative Anti-Aging and Complementary Medicines from Pasadena, California. And genetic is a gun, and epigenetic is a trigger or the bullets. So you can control the gun if you have the trigger in your hand and the bullets. Okay, so I'm going to talk about genetic and epigenetic this month. Now next week, tune up because I'm going to invite a genetic research specialist that is I'm very impressed with his knowledge. So tune up, same time, same day next week. Thank you for listening.